Can ADHD be mistaken for a sleep disorder? Have you ever wondered if attention deficit hyperactivity disorder can be confused with a sleep disorder? This is a question that many people ask, especially when they notice overlapping symptoms. It turns out that yes, attention deficit hyperactivity disorder can indeed be mistaken for a sleep disorder. This happens because many symptoms of attention deficit hyperactivity disorder overlap with those caused by sleep issues. Individuals with attention deficit hyperactivity disorder often face sleep challenges. They may struggle with falling asleep, staying asleep, or achieving good sleep quality. These sleep problems can make symptoms like inattention, forgetfulness, impulsivity, and hyperactivity even worse. For instance, when someone does not get enough sleep, they may feel tired during the day. This fatigue can mimic the symptoms of attention deficit hyperactivity disorder, making it hard to tell the two apart. In children, the situation can be even more complicated. If a child is not sleeping well, they might show hyperactive or impulsive behavior. This can lead to misdiagnosis, as caregivers might think the child has attention deficit hyperactivity disorder when it is actually a sleep issue. From a sleep wellness perspective, it is essential to understand that attention deficit hyperactivity disorder and sleep disorders often coexist. Many people with attention deficit hyperactivity disorder are at a higher risk for specific sleep disorders. These can include insomnia, circadian rhythm disorders, restless leg syndrome, and sleep apnea. These sleep disorders can worsen symptoms that look like attention deficit hyperactivity disorder during the day. The relationship between attention deficit hyperactivity disorder and sleep issues is linked to how the brain regulates alertness and the circadian rhythm. The circadian rhythm is the internal clock that controls sleep-wake cycles. In people with attention deficit hyperactivity disorder, there may be a delay in the releases of melatonin. Melatonin is the hormone that signals the body to prepare for sleep. This delay can lead to later bedtimes and difficulty falling asleep, which can create a cycle of sleep deprivation. Chronic sleep deprivation can worsen attention and executive function problems, which are controlled by the prefrontal cortex of the brain. Because of this connection, healthcare professionals often recommend checking for sleep issues before diagnosing or treating attention deficit hyperactivity disorder. Addressing sleep problems can be beneficial. Good sleep hygiene, behavioral interventions, and treating any underlying sleep disorders can help improve symptoms that resemble attention deficit hyperactivity disorder. For some individuals, stimulant medications for attention deficit hyperactivity disorder may improve daytime alertness and indirectly help with sleep. However, for others, these medications can make sleep difficulties worse. To better understand this relationship, it is important to assess sleep patterns and quality when evaluating someone for attention deficit hyperactivity disorder symptoms. Considering circadian rhythm disorders is also important, especially delayed sleep phase syndrome. Implementing strategies to improve sleep hygiene can make a difference. This includes having consistent bedtime routines, reducing blue light exposure before sleep, and managing stress. Improving sleep can also enhance sensory processing and executive functioning, both of which are often impacted in attention deficit hyperactivity disorder. Overall, due to the overlap in symptoms and the frequent coexistence of attention deficit hyperactivity disorder and sleep disorders, it is clear that attention deficit hyperactivity disorder can be mistaken for a sleep disorder or vice versa. A thorough evaluation that focuses on sleep wellness is essential for accurate diagnosis and treatment.